Welcome, deep divers. Today, we're diving headfirst into something we all see online, right? Those blackhead extraction videos.
Oh yeah, they're everywhere. So satisfying to watch, but
Exactly. Satisfying, but also kind of misleading. We see the pop, the instant gratification, but what are those clips really showing us? And maybe more importantly, what are they not showing us about the science, the right way to do it, and, the actual dangers?
that's exactly what we're here for today. We want to cut through that noise,
Yeah.
give you a shortcut, really, to understanding the actual medical protocols, the stuff dermatologists use,
Okay.
and look at how some of that can be adapted safely for home. This isn't about that quick fix pop you see online.
Right.
It's about understanding your skin, the science behind it, making smart choices for the long run.
And here's a big reality check from our sources, which honestly might surprise you. Those viral videos.
They skip so much.
So much. Like the really careful skin prep, needing the right sterile tools, a clean environment.
And the training,
Yeah,
years of it.
exactly. It turns out pro extraction isn't just about yanking out what you see. You need to know skin anatomy, the different kinds of comedones. That's the technical term, right?
Right, comedones, clogged pores, and knowing the difference
Yeah.
is crucial because the stakes are pretty high.
How high?
Well, one wrong move at home, you could end up with permanent scars,
Hmm.
or push an infection deeper, or get that post-inflammatory hyperpigmentation, dark spots that stick around for ages.
Oof.
But here's the flip side, and this is exciting. A lot of the pro techniques can be adapted.
If you know what you're doing.
Exactly. If you understand the science and follow the steps precisely, research shows pros have like a 94% success rate, minimal issues.
Wow, 94%.
But at home, if you ignore the protocols, that drops to maybe 60%, and complications shoot way up.
So it's really about the knowledge, not just being able to squeeze something.
Fundamentally, yes, knowledge is key.
Okay, 94 versus 60, that really hammers it home.
Yeah.
So let's unpack this. What's the main tool the pros rely on, and how can we find a good equivalent for home? It's not about fancy gadgets, you said.
Not necessarily. The absolute gold standard is the loop end comedone extractor.
Okay, the loop thing.
Yeah. Think of it like a precision tool. It applies gentle, even pressure around the blackhead. Doesn't damage the skin next to it.
Makes sense.
They're usually surgical stainless steel, really smooth edges that's critical. Any roughness can tear the skin.
Ah.
And size matters. You need a smaller loop, maybe 2-3 millimeters for the small one,
Right?
and a bigger one, 4 or 5 millimeters, for larger blackheads. For home use, you can find really good ones that meet these standards. Brands like Tweezerman or Sephora Collection, they make professional grade options.
Good quality, but not crazy expensive.
Exactly. Professional results without the professional clinic price tag.
That detail about the tool itself is interesting, but here's what our sources kept flagging. The sterilization. That seems to be where things really go wrong at home.
Oh, absolutely. It's the Achilles heel, the step people skip, and where the infection risk just skyrockets.
So what's the real pro way to sterilize?
It's super precise, 4 steps, non-negotiable. First, wash the tool thoroughly, antibacterial soap, hot water. Second, soak it. 70% isopropyl alcohol, at least 30 seconds.
30 seconds, got it.
Third, let it air dry completely. Don't wipe it with a towel that just puts bacteria back on.
Right, air dry.
And here's the kicker, the real pro step. You re-sterilize the tool between every single blackhead you extract.
Wow. Between each one.
Yep, prevents cross-contamination. Stops you spreading bacteria from one pore to another.
Meticulous.
It has to be. And your hands, too. Scrub them for 20 seconds, antibacterial soap, get under the nails. Disposable gloves, highly recommended.
Okay, gloves.
And make sure your surface is clean. Like lay down a fresh towel you just washed in hot water. Sterile-ish field.
Right, okay, so tools, sterile, hands clean, surface prepped. Now the main event, what's the actual step-by-step that dermatologists use? The safe way for us at home.
Okay, let's walk through that 7-step method.
Yeah.
It's designed to minimize trauma, maximize results.
Let's do it.
First step, logically, is complete facial cleansing. Gentle, oil-free cleanser, get everything off makeup, sunscreen, dirt. Double cleanse if you wear heavy stuff.
Makes sense. Clean canvas.
Exactly. Step 2, gentle exfoliation.
Yeah.
Either physical or chemical. Salicylic acid is great here. It gets into the pores.
Okay.
Leave it on for maybe 10-15 minutes. It loosens dead skin, softens the comedones, makes them easier to get out.
Softens them up. Got it.
Step 3, and this is crucial, steam preparation. Pros have machines, but at home. Boil water, put it in a bowl.
The old towel over the head trick.
That's the one. Drape a towel over your head, steam your face for 8-10 minutes. The warmth and moisture Really opens pores, softens blackheads even more, makes extraction way easier, less damaging.
Okay, prep is key. Then what?
Then comes assessment and selection. And you need to be picky here.
Right, don't just go after everything.
Absolutely not. Only extract blackheads that are clearly visible, dark, look kind of soft.
What should we avoid?
Anything deep, hard, red, or inflamed. Those are off limits for home extraction. Needs a pro.
Got it. So you've picked one, now the technique.
Step 5. Proper extraction technique. Center the blackhead in the loop of your clean extractor.
Okay.
Apply gentle, even pressure straight down. Then little sweep to one side. The absolute key word is gentle.
Gentle.
If it doesn't pop out easily, with minimal effort, stop immediately. Never ever force it.
Because forcing leads to...
Skin damage, scarring, pushing gunk deeper. Seriously, don't force it.
Okay, golden rule. Don't force it. What happens right after it comes out?
Step 6, immediate aftercare. Clean the spot with an alcohol-free antiseptic. Stops bacteria.
Antiseptic, right.
Then maybe a spot treatment, benzoic peroxide or salicylic acid. And don't touch it. Keep your fingers away.
Resist the urge.
Definitely. Finally, step 7, recovery monitoring. Keep an eye on the area. Should look better in 24-48 hours.
And if it looks worse?
Increasing redness, swelling, pain, that's a sign to call a professional right away.
How long should this whole thing take? And how often?
Realistically, the whole process, start to finish, maybe 45 to 60 minutes. And frequency, no more than once every 4 to 6 weeks. Give your skin time to heal.
4 to 6 weeks. Okay. That's incredibly detailed. And that never force it rule seems paramount.
It really is.
But you know, while manual extraction gets the spotlight, you mentioned chemical extraction, maybe a safer route for many.
Absolutely. Chemical exfoliation is a true powerhouse. It's more about prevention, less invasive.
So what works best there for home use?
Salicylic acid is the gold standard. It's oil soluble, so it gets into the pores.
Oh,
Clears them out, reduces oil, and helps prevent new blackheads. That's the key difference. Pro peels are strong, like 20-30%.
Whoa.
But for home, 0.5% to 2% is safe and really effective used consistently.
How do you start?
Start low and slow, maybe 0.5% twice a week. See how your skin does, then gradually increase frequency or strength.
Yeah.
Always on clean, dry skin. Let it absorb. And please, don't just layer actives without knowing how they interact.
Right, that can cause problems.
Big problems, irritation, burns. Then there's glycolic acid. It works differently.
How so?
It works more on the surface, removes the top layers of dead skin cells, helps unclog pores from the top down, improves texture.
So different angle.
Yeah. Home versions are usually 5-10%. Pros use much higher, 35-70%. A good strategy can be alternating them salicylic one day, glycolic another. Avoids overdoing it.
Alternating, okay. What about retinoids?
Retinoids like adapalene. They're special. They tackle the root cause
How?
by speeding up cell turnover, stops dead skin cells building up in the pores in the first place. Adapalene, like different you can get over the counter. Great for prevention.
How do you use that?
Again, start slow, every other night, let your skin adjust, then maybe nightly. And always use sunscreen with retinoids. They make you more sun sensitive.
Good tip. Sunscreen, always. Okay, that's a great look at chemical options. But what if you're doing all this, the careful manual extraction sometimes, the chemical stuff consistently, and you still have stubborn blackheads? Or you want bigger improvements? When is it time to level up and see a pro?
That's a really important question. There are definitely times when professional help is the next logical step.
Like what?
Well, microdermabrasion is a popular one. Uses fine crystals or a diamond tip to basically sand off the top layer of dead skin.
Right.
And it has suction too, vacuums out debris. Great for texture, clearing surface stuff. There's also hydrodermabrasion, which is newer. It does the exfoliation, but also infuses serums like hyaluronic acid, antioxidants right after.
Oh, nice. Like a 2-in-1.
Kinda, yeah. Usually needs a series, maybe 6 to 8 sessions for the best results. Skin looks smoother, clearer.
Okay. What else?
Then you have chemical peels. We talked about home versions, but pro peels, much stronger.
Way higher concentrations.
Exactly. Salicylic peels, 20-30%, get really deep for stubborn blackheads. Glycolic peels, 35-70%, are amazing for overall texture, fine lines, tone.
Broader benefits.
And there are combination peels, like the Jesner peel, that tackle multiple things at once. These usually need some skin prep beforehand, maybe using tretinoin for a few weeks, and careful aftercare.
Right, more intense requires more care.
Definitely. And then the most advanced stuff, laser and light therapies.
Okay, lasers.
Yeah, things like photopneumatic therapy. Combines light pulses with vacuum suction. Really effective for clearing pores and reducing inflammation.
Light and suction.
Or specific lights. Blue light targets the acne bacteria, P. acnes. Red light reduces inflammation, helps healing.
Targeted approach.
And for texture and pores, fractional laser treatments. They create tiny controlled injuries, stimulate collagen, big improvements in texture, pore appearance.
Wow, quite a range of options there. Okay, so whether it's careful home extraction or a pro treatment, what happens after is key, right? You mentioned avoiding disaster.
It's absolutely make or break. That post-extraction period is critical.
So what's the protocol? First 24 hours?
Super gentle, mild, non-fragrance cleanser. No active ingredients, no acids, no retinoids for that first day. Skin needs to start healing.
Just let it rest.
Pretty much. Hydrate, but use something lightweight, non-comedogenic. Hyaluronic acid is good. And sunscreen, non-negotiable. SPF 30 plus broad spectrum. Skin's vulnerable.
Okay, gentle, hydrate, protect. What about the next couple of days?
Days 2 and 3, so 48, 72 hours. Some redness, maybe minor swelling, bit of flaking that's normal, part of healing.
But what's not normal?
Crucially, if you see pain getting worse, redness spreading, or any pus, that's infection. See a professional immediately.
Okay, clear warning signs. Then into the first week.
You can slowly start reintroducing your active ingredients. Maybe start with something gentler like lactic acid first, then back to your salicylic or retinoid.
Ease back in.
Exactly. And long term, consistent chemical exfoliation, good cleansing habits, maybe regular pro treatments every 6 to 8 weeks. That's how you prevent them coming back.
That recovery roadmap is super helpful, but it all comes back to making decisions at home, doesn't it? Knowing your limits, knowing when to just stop.
That might be the most important skill, honestly.
Yeah.
Respecting your skin. Our sources give clear red flags for when you absolutely need a pro.
Okay, what are they?
First, if a blackhead doesn't budge with gentle pressure, remember the rule.
Never force it.
Never force it.
Yeah.
If it's not coming easily, leave it alone. Forcing causes damage.
Got it. What else?
Second, any sign of inflammation. Red, swollen, painful, don't touch it. Needs professional assessment.
No inflamed ones.
Third, location, location, location. Sensitive areas like around the eyes, upper lip, sides of the nose. Skin's thin there, scars easily. Best left to the pros.
Makes sense. Delicate areas.
Fourth, if you've tried gently on the same blackhead a couple of times and it's not working, stop trying. Repeated poking just causes irritation and potential scarring.
Right. Don't keep attacking it.
And fifth, any bleeding that doesn't stop pretty quickly. A tiny pin prick maybe, but real bleeding, that's tissue damage.
Okay, those are clear signals. You mentioned a danger zone too.
Yes, the triangle of death. Sounds dramatic, but it's serious. The area from the corners of your mouth up to the bridge of your nose.
Why is that area so risky?
Blood vessels there connect directly to sinuses near the brain. An infection in that triangle can potentially spread and become very serious very quickly. Many pros are extra cautious there.
Wow. Okay, definitely avoid DIY in the triangle. What needs immediate attention?
Fever after you've done extractions. Red streaks coming from the site. Pain getting worse after 24 hours, not better. Or if a spot just isn't healing after 48 hours, call someone.
Got it. Are there individual things to keep in mind too?
Definitely. If you have darker skin, you're more prone to post-inflammatory hyperpigmentation, those dark spots. So extra gentle is key.
Right.
If you have conditions like rosacea, eczema, dermatitis, probably best to avoid home extraction altogether. Too risky for flares.
Check.
And think about meds. Using retinoids already makes skin fragile. Blood thinners obviously increase bleeding risk. You need to factor all that in.
That is a lot to consider, but also practical. It really drives home the main point, doesn't it? Respect your limits.
Absolutely. There's a reason dermatologists train for years. Skin is complex, everyone's different.
Yeah.
And this raises, I think, an important point. It's about the power of informed choice, right? You see those satisfying quick fixes online, and they're tempting, but real, lasting results. That comes from actually understanding your skin.
Knowing what it needs.
Respecting its processes. Knowing when you can safely use these adapted techniques. And just as importantly, knowing when to say, nope, this one's for the experts.
That's a great way to put it. We've covered a massive amount today, from sterile tools and the 7-step method to chemical options and, crucially, knowing when to stop or seek help.
You definitely know more now than most people trying this at home.
So remember, everyone, healthy skin. It's a long game, not a quick fix. Keep exploring, keep learning.
And treat your skin with the knowledge and respect it deserves.
Thanks so much for watching. If you enjoyed the video, feel free to give it a like and subscribe to the channel so you don't miss any of our upcoming content. And we'd love to hear from you in the comments. It really means a lot to us.